about a study we've been telling you about that says there has been a big increase, a 70% increase in the number of egg donors.
And the study says more young women are donating eggs for money. But here in East Texas, that may not be the case. East Texas News' Shaylee Sanders spoke with a doctor who specializes in reproductive endocrinology and infertility, who lays it all on the line.
Dr. Anil Pinto says while sometimes a challenging economy can lead to more paid egg donors, he's seen an increase in known donors.
We've seen patients who are finding friends and relatives who are willing to donate eggs.
He says the advances in technology and the fact that it's becoming more culturally acceptable may also contribute to these growing numbers.
About 15 years ago, patients needed an operative procedure to try and harvest the eggs. Well, now it's just an outpatient procedure.
Dr. Pinto says every egg donor who comes through his office must be screened psychologically before they're taken through the entire process.
Because down the road, she may have that guilt feeling when she's not getting pregnant, that maybe she has a child somewhere that she would like to connect with.
Dr. Pinto says while he does not believe there are any long-term physical consequences to donating eggs, he wishes there was more data on the long-term psychological impact this procedure could have. He also says, as with any other medical procedure, there are some risks.
Some patients are extremely sensitive to the drug and may produce a whole bunch of eggs, a lot more than another patient. And if that does happen, there's a 1 to 2% chance that they might need hospitalized. It is very important that they're not sexually active after the procedure, because there have been several reports where egg donors have inadvertently conceived with multiple pregnancies.
He says the ovaries will also expand and can cause some discomfort. Dr. Pinto says he discusses all of this with his potential egg donors and follows up to answer any questions.
I feel that is critical, because there should not be any regret down the road that a patient went forward with doing an egg donation without understanding the implications, the complications, and the possible risks she undertook.
Shaylee Sanders, East Texas News.
Dr. Pinto says only about 10% of egg donors come in for appointments with a support system. He recommends anyone that is considering donating their eggs to have someone to help walk them through this process.